Welcome to Dual Diagnosis Anonymous. My name is Johnny and I am Dual Diagnosed, and I'll be facilitating this meeting. Can we please take a moment of silence followed by the serenity prayer? God, grant us the serenity to accept the things we cannot change, the courage to change the things that we can, and the wisdom to know the difference. Again, thank you for tuning in to DDA of Tulsa. I got a lot of ground to cover today because I picked one of my favorite topics so that I can help those out there that's watching these videos understand a little bit better of what they're dealing with. I was talking to a young man this week, early in the week at work, one of the patients, and as we was talking, he made the comment of he don't like having a diagnosis. And I told him that, that's probably one of the reasons why you're struggling. Because you, like a lot of other people, don't want to accept your diagnosis. You think it's a bad thing. You think that it sets you apart from everybody else, and it doesn't. It just makes you unique. It gives you the ability to do things that other people don't do if you learn how to understand it. And so, just like I did with him, today I want to do the same with you all that's watching this video. It's to help you to understand the importance of understanding your diagnosis. I mean, understanding it is the only way that you're going to be able to manage it. Understanding it is the way that you live with it. Understanding it is the way that you learn how to help other people to understand what it is they're struggling with. And so today, I want to give everyone an opportunity to do that. And so I'm not going to talk much about my personal stuff or like I normally do with the stories, but I am going to cover this information about understanding your diagnosis. So why is understanding your diagnosis so important? Mental health includes our emotional, psychological, and social well-being. It affects how we think, how we feel, and how we act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence throughout your adulthood. Some people with mental health conditions experience relief and hope when they get a diagnosis. Others may feel like a diagnosis is just words. You may even feel several competing emotions at the same time. Relief at having a name for the things bothering you, but fear and anger that you have an illness. You may feel that the diagnosis you received carries negative and damaging perceptions and may not want to accept it. But getting a diagnosis is a useful step in receiving effective treatment and improving your quality of life. What is an anxiety disorder? Anxiety disorders are a group of mental disorders characterized by significant feelings of anxiety and fear. Anxiety is a worry about future events, and fear is a reaction to current events. These feelings may cause physical symptoms such as fast heart rate and shakiness. What is a panic disorder? Panic disorder is characterized by uncontrollable recurrent episodes of panic and fears that peak within minutes. Panic attacks are accompanied by physical manifestations such as heart palpitations, sweating, and dizziness, as well as the fear of dying and becoming insane. Worry about having an attack may lead to additional anxiety and avoidance behaviors or to other problems in functioning. What is depression? Depression is more than just sadness. People with depression may experience a lack of interest and pleasure in daily activities, significant weight loss or gain, insomnia or excessive sleeping, lack of energy, inability to concentrate, feelings of worthlessness or excessive guilt, and recurring thoughts of death or suicide. Depression is the most common mental disorder. Fortunately, depression is treatable. A combination of therapy and antidepressant medications can help ensure recovery. What is concealed depression? Someone who suffers from concealed depression specifically is programmed to deal with their symptoms in a way that makes them easy to be missed by outsiders. These people often bottle up their thoughts and emotions, putting up a happy front for everyone else when in reality they struggle with sadness or finding a purpose in life. In extreme cases, even having suicidal thoughts. What is PTSD? Post-traumatic stress disorder is a trauma and stress-related disorder that may develop after exposure to an event or ordeal in which death, severe physical harm, or violence occurred or was threatened. Traumatic events that may trigger PTSD include violent personal assaults, natural or unnatural disasters, accidents, or military combat. What is secondary PTSD? Secondary PTSD is not a disorder which is recognized by the Diagnostic and Statistical Manual. However, if you live with someone who suffers from PTSD, you may notice yourself beginning to mirror some of their behaviors. What is bipolar disorder? Bipolar disorder is also known as manic depressive illness, or a group of brain disorders that causes unusual shifts in mood, energy, and ability to function. The symptoms of bipolar disorder are severe and can result in damaging relationships, poor job and school performance, and even suicide. What is ODD? Oppositional defiant disorder. Oppositional defiant disorder is a childhood disorder that is characterized by negative, defiant, disobedient, and often hostile behavior towards adults and authority figures primarily. What is an addictive personality disorder? An addictive personality is a set of personality traits that make an individual more prone to develop addictions to drugs, alcohol, or other habit-forming behaviors. What is addiction? Addiction is a condition in which a person engages in use of a substance or in a behavior for which the rewarding effects provide a compelling incentive to repeatedly pursue the behavior despite detrimental consequences. Addiction may involve the use of substances such as alcohol, inhalants, opioids, cocaine, nicotine, and others, or behaviors such as gambling. What is impulsive behavior? Impulsive behavior means acting without thinking about the impact of your actions, which can include anything from drunk driving to stealing something from a family member. What are night terrors? Sleep terrors are episodes of screaming, intense fear, and flailing while still asleep. Also known as night terrors, sleep terrors often are paired with sleepwalking. A sleep terror episode usually lasts from seconds to a few minutes, but episodes may last longer. What are nightmares? Sometimes a nightmare is just a bad dream, isolated and disagreeable imagery with little emotional response from the dreamer. Normally, people dream more than 2 hours a night, and the nightmare usually happens in the later hours of the REM sleep, or rapid eye movement sleep. What is alcoholism? Alcohol is commonly used to celebrate, relax, or socialize with others, and drinking in moderation is typically seen as a reasonable behavior. But when we drink in excess or drink as a way to cope with stressors or avoid problems, it can lead to physical behavior and emotional risk. Age, family history, and how much or often we drink are important variables to keep in mind when considering our relationship with alcohol. What is attention-seeking behavior? Attention-seeking is behaving in a way that is likely to elicit attention, usually to hearten oneself by being in the limelight, or to elicit validation from others. Enjoying the attention of others is socially acceptable in some situations. What is borderline diabetic? Borderline diabetes, also known as prediabetes, is a condition that develops before a person gets type 2 diabetes. It is also known as impaired fasting glucose or glucose intolerance. It basically means your blood sugar levels are higher than normal, but they are not quite high enough to be considered a sign of diabetes. What is paranoid schizophrenia? Schizophrenia is defined as a chronic mental disorder in which a person loses touch with reality. This helps to differentiate schizophrenia from other mental disorders, such as bipolar. What is schizophrenia? Schizophrenia is a chronic brain disorder that affects less than 1% of the U.S. population. When schizophrenia is active, symptoms can include delusions, hallucinations, trouble with thinking and concentration, and lack of motivation. However, with treatment, most symptoms of schizophrenia will greatly improve. What is borderline personality disorder? Borderline personality disorder, also known as BPD, is a serious mental illness characterized by pervasive instability in moods, interpersonal relationships, self-image, and behavior. This instability often disrupts family and work life, long-term planning, and an individual's sense of identity. What is GID? Gender Identity Disorder. It's defined by strong, persistent feelings of identification with the opposite gender and discomforts with one's own assigned sex. Those results in significant distress or impairment. What is dissociative identity disorder, also known as DID? Pervasively known as multiple personality disorder, is a mental disorder characterized by at least two distinct and relatively enduring personality states. There is often trouble remembering certain events beyond what would be explained by ordinary forgetfulness. What is ADHD? ADHD stands for Attention Deficit Hyperactivity Disorder. It is a medical condition. A person with ADHD has differences in brain development and brain activity that affects attention, the ability to sit still, and self-control. Inferiority complex. An inferiority complex is a conscious or unconscious feeling that one is not as good as others. What is RAD? Reactive Attachment Disorder. It's one of the few disorders listed in the DSM-5 that can be applied to infants. It is a disorder caused by a lack of attachment to any specific caregiver at an early age, and results in an inability for the child to form normal, loving relationships with others. Dissociative disorders are mental disorders that involve experiencing a disconnection and lack of continuity between thoughts, memories, surroundings, actions, and identity. Dissociation disorder. Dissociation is a mental process that causes a lack of connection in a person's thoughts, memories, and sense of identity. And what is a narcissist? Narcissism is the pursuit or gratification from vanity or egotistic admiration of one's idolized self-image and attributes. The term originated from Greek mythology, where the young Narcissus fell in love with his own image reflected in a pool of water. Narcissism is also considered the social and cultural program. Recovery from a mental illness is expected. It is not a life sentence. You can also learn how to cope with symptoms so they don't have a big impact on your day-to-day life. Treatment from a mental illness may include a combination of medication, talk therapy, and healthy living skills. Your exact combination will be unique. There is no set formula that works for everyone, so it may take some time to find the best combination that works for you. There are different ways to look at recovery. Most people talk about recovery in terms of controlling symptoms so they can live well. Everyone's recovery journey looks different. Some parts may take a long time while others will pass quickly. You may even take a few steps back from time to time. You can learn a lot about living with a mental illness from others who have experienced similar things. The most important thing to remember is that recovery does happen for most people. And there are things that you can do, the things you and others can do to help you to improve through your journey. It may have taken a long time, and you might be a bit confused by all the information that you just heard. But a diagnosis can be very helpful. It will help you and your mental health professional find the right treatment plan for you. And it can also help you to access mental health services in our community. This is why understanding your diagnosis is so important. And I wanted to share that with you all because a lot of people that come into the hospital, they like to blame everything on their diagnosis. And unfortunately, I have to be the one to help them to understand that your diagnosis, you can't blame your diagnosis for your behaviors. You just can't blame it. Because some of our behaviors are of our own making. If you understand your diagnosis, you don't have to act like your diagnosis. And that's one of the things that I pride myself on, is helping people to understand that we are not our diagnosis. Our diagnosis is just a part of who we are. That's why it's important to get to know your diagnosis, so that when you talk to people, you are the one that has to help people to understand your diagnosis. Your diagnosis can't help them to understand. When you're acting in your diagnosis, people just look at you like you're crazy. I know that a lot of people are not crazy. They might be unbalanced, but they're not crazy. They might do crazy things, but that doesn't make a person crazy, because everybody done did something that they shouldn't have done. A lot of people act on impulse. That's why I put all of that in there. Impulsivity is a diagnosis. That means you do things before you think. I'm in recovery for that myself. But a lot of those diagnoses, a lot of that stuff is mine. A lot of those diagnoses is people that I've come across over the years of being in recovery. And I just put all that information together so that everyone can understand that it's okay to have a diagnosis. Because when you understand your diagnosis, most of the time you don't act like your diagnosis. People won't even know that you have one until you share it with them. And that's what I love about it. When I walk around that hospital, I just be walking through there. I do my 15-minute checks, and I don't say anything about being in recovery. I don't say anything about being dual diagnosed. I don't even say anything about my support group. But when someone asks, or I do a group, the patients sit there and they look at me in amazement, because it's something that they did not expect. And like I tell them, I'm no different than they are. I've just did my research on my diagnosis so that I can understand it. Because if I got to live with something, I need to understand it. And like I shared with them this week, a lot of people problems with relationships is they don't do no research on the person that they're getting involved with. And so once in the beginning, everything is all cool and everything is all fine and lovey-dovey, but then after a while, their diagnosis shows up. Or your diagnosis shows up. Or your past trauma or your past events shows up. Now everybody is shocked. Well, he wasn't like that in the beginning. Yeah, he was. Yes, he was. You just didn't pay attention to it. Because if you don't pay attention to your own red flags, you don't pay attention to others. And we want what we want when we want it. And that's where we go wrong. See, that's one thing about companies. Is before they hire someone, they always get their background. They always check to see. They always ask questions about where they've been and where they come from. See, what they're doing is they're understanding who they're dealing with so that they can trust the person that they're dealing with. And the only way you can trust somebody is to get to know them. And then you determine if you want to deal with them or not. So understanding your diagnosis is the same way. I highly recommend that you spend some time getting to know yourself. That's why last week when I was talking about reconnecting with yourself is so important. When I said that, I meant even when it comes to your diagnosis, don't let somebody just give you a diagnosis without you doing your research. Find out if the diagnosis that you've been given is lining up with your symptoms, and only you can do that. You know your symptoms, just like I know mine. And then you do your research. And then you start learning how to have a relationship with your diagnosis. And then the next thing you know, you and your diagnosis become best friends. You get to know one another. So whenever I'm starting to get into one of them funks, I know what I need to do. And one is I need to get away from people so that I can handle what I got over here. And then once I handle this, then I go around people. But I got to take care of home first. I got to take care of me first. Because just like this body is a temple of the Holy Spirit, this body is also the temple of where I live with my diagnosis. Because whatever I'm connected to is connected to me. Wherever I reside, it resides. Same for you. So take heed to this message and understand that understanding your diagnosis is important. Don't be like that guy at the hospital and act like it's a bad thing, because it's not. It's a bad thing not understanding it. That's what's bad. And that's why so many people are out of balance, because they don't understand their diagnosis. When you understand your diagnosis, you know what you learn how to balance that out. See, I know when to talk about my diagnosis and I know when not to. Depending on what mood I'm in, determines on which diagnosis is I need to pay attention to. If I'm feeling sad, I know it's my depression. And see, there are so many different types of depression, just like there's different types of anxiety. There's 6 different types of PTSD. There's so many different types. And GID, gender identity disorder, see, a lot of people have that and don't even realize it. A person with GID has a problem with their assigned sex. I've had patients come in and say that they felt like a woman in a man's body, and I've had men come in and say they feel like a man trapped in a woman's body. That's some deep stuff. But I never would have understood that if I hadn't done my research and study on it. And that's why I put it all in that information, so that others can understand it's more to it than what they think. And most people just lack the education. And when you lack education, you lack the understanding. But glory be to God that He's given me the ability to get that understanding, the ability to do the footwork that it takes, and the willingness to share that with others. So I hope that you all get a lot out of this. Like I said, it's a lot of information to cover, but I covered it. That's why I broke it down real simple, so that I don't stress nobody out. It's a lot more to it than that, but I can only give you what you can handle. So I appreciate you all for tuning in. And just like we do always, we close out with Just for Today. Just for today, I will focus on my DDA recovery program of the 12 steps plus 5. Just for today, I will remain clean and sober, and if I'm taking medication, I will do so as prescribed. Just for today, I will keep an open mind and be willing to listen to the advice of my DDA support group, my prescriber, and my clinician. Just for today, I will allow myself to have faith in someone in the DDA program who has faith in me and my recovery. Just for today, I will have a program. I recognize that I may make mistakes along the way, but I will follow the DDA program to the best of my ability. Just for today, I will utilize the DDA program of shared experiences, strength, solidarity, and hope in order to gain a better perspective on my life. Just for today, I will not dwell on the past nor place undue concern on the future. Just for today, I will not grant fear, worry, space in my thoughts by choosing to live one day at a time And by following the principles of DDA, I need not be afraid. Just for today, I will see how working an honest program is helping others and allow the blessings of my higher power to flow throughout my life. Just for today, I will allow myself to be me. I will accept myself for whom I am and where I am. I will allow others the same courtesy, that they may be free to grow and that I may be freed from the burden of resentments. Just for today, I will live and let live. If I become unable to do this, then I will place trust in my higher power and remind myself to just let go and let God. Just for today, I will live life on life's terms. And by doing so, I will recognize when I need support for my symptoms of dual diagnosis or when I'm in danger of relapse. I will seek help from the fellowship of DDA, my higher power, my prescriber, and my clinician. Just for today. And then for those of you that's watching these videos, if you would like to come down and visit with us at the main meeting, at the main building, the address is 708 South Boston from 6 to 7 every Friday. And I hope to see you all there. I hope that you have a wonderful weekend. God bless you, and we'll see you soon.